ventricular fibrillation, with the abbreviation as we know, VF. Every second counts. First, we'll start with the definition, which is a chaotic, uncoordinated ventricular activity that results in no effective cardiac output and leads to sudden cardiac death if not treated immediately. As we find here the ECG of ventricular fibrillation, you can see that it's chaotic, irregular amplitude, no identifiable B waves, QRS, complexes, or T waves, which might leads to cardiac arrest. So what are the key points? VF is a shockable rhythm. Early defibrillation within 3 to 5 minutes will increase the survival up to 70%. CPR plus defibrillation is the most effective treatment. Using automated defibrillation, AED, as soon as possible might save life. You can see that the common causes are acute myocardial infarction, coronary artery disease, cardiomyopathy, heart failure, electrolyte abnormalities, hypokalemia or hypomagnesemia, drug toxicity, overdose, and severe hypoxia. Of course, electrical shock, genetic disorders. What is the immediate management? If we recognize someone who is unresponsive, no pulse, not breathing or gasping, we should call the emergency. Then, using CPR, high quality CPR starting immediately, defibrillate, shock as soon as possible using automated defibrillation, AED or manual, and medications, epinephrine, amiodarone, or lidocaine. The long-term management for this case will be implantable cardioverter defibrillator, ICD, treat underlying heart disease, modify the lifestyle and risk factor control, patient education, and regular follow-up. Here we represent the differential diagnosis between ventricular fibrillation and ventricular tachycardia, pulseless electrical activity, asystole flatline, Torsets D points. What are the features? The features will be ECG example, pulse, cardiac output, causes, treatment priority, or is it shockable? First, at ventricular fibrillation, we can see the ECG chart shows chaotic irregular waveform, no peak